All right. New guest on the show today to figure out how we can be fit and healthy from the inside out as we age in all stages of life. And I am happy to talk to Dr. Manna, who is actually just about 25 minutes probably from me, and talk about your passion, purpose, and your mission. So thanks for coming on the show and helping us learn something new today.
I am so glad to be here today, Debbie.
Yeah, well, I always love to start the conversation of who are you? What do you do? Why do you do it? What's your purpose?
Hmm. I was having this conversation with a bunch of women earlier this morning. We had a meeting and we're trying to organize an event for these enterprising women. And it was all about discover your why and your
Uh,
purpose. And I was like, I'm kind of done with that.
yeah.
It was like a long time. There was a lot of work that went into it, but I'm glad it's done. In a way, it's never really done. You keep
Uh-huh.
working on it, but it's kind of like, okay, I'm at a good place and now I can just keep moving into more of the areas that I've defined are meaningful for me. So,
Mm.
coming back to this question, I am a naturopathic and functional medicine doctor, and I feel very drawn to working with midlife women, of course,
Mm-hmm.
figuring out how to help them optimize their health and fitness, health and wellness, so they can pursue their personal and professional goals as they want to. Right. So we don't want anything to hold us back. Whatever
Mm-hmm.
decisions we want to make from a position of strength and resilience and
Mm.
not have to get pushed into a decision, right? Like, okay, if you're in your early 40s or mid 40s and you're beginning to feel fatigue, exhaustion, and burnout, which was my experience,
Me too.
um, right? And like I had to quit a job that I loved because I just didn't have the energy to keep going.
Yeah.
And my passion now is to help women prevent that,
Yes.
right? Burnout is really, it's hard to recover from that, right? It's
Mm-hmm.
hard to recover from burnout because so much time is spent in that slow downward slide, and then coming back out of that deep, dark hole can be difficult. So
Yeah.
my passion is to help women recognize, um, first of all, understand what can happen in your 40s
Mm.
and be informed of what are the options out there and when the time comes for them to choose the right thing for them so that they stay in a position of strength and resilience. And whatever
Mm-hmm.
decisions they make, whether they decide to quit work or stay at home or start a business or whatever, that they're fully capable of making that decision and not be forced into that decision. So I'm really passionate about using personal health, seeing personal health as a foundation for the rest of your life and as a foundation for leadership, whether it is in your community, in your family, in your work, in your businesses, right?
Yeah.
We know it's like the base, it's the foundation of everything. So
Mm.
that's where I am. That's what I love to do.
Yeah, I feel similar story that it's a burnout and breakdown of our body systems and trying to help other people avoid going through what we went through because there are signs and symptoms, those red flags that we as high performers ignore and push through because we think we're so much better than that. We can be strong and work through it, but that doesn't always work. As it happened to me 10 years ago, and it continues to be similar to my purpose that I'm trying to help people avoid that journey. That's like the struggle is real, but we can not take that road. We can take a side road if we know the tools and being aware of, oh, I need to stop, push, pause, and reset my body and be aware
Absolutely.
of those
And I
flags.
think what happens is by the time we are in our 40s, we also, what ends up happening is we have a lot on our plate, and we feel that if we are tired or exhausted, it's probably because we have a lot on our plate. And it's true.
Mhm.
Of course, it's true. But what we are not educated about is what are all the changes that are happening in the body simultaneously and the drawdown from those changes in our body. So two things are happening at the same time. We keep attributing all of it to the one, but nothing to the other. And I
Mhm.
think that lack of education, that lack of knowledge, lack of information, that is what hurts us a lot. So
Mm.
if we knew, if we had this information, then we would be like, oh, I have all this stuff going on in my life, and there is this other thing happening, and I can do something about it right from the beginning of that time instead of waiting 10 years and then doing something about it.
Yeah, that's funny. I feel like we need an operating manual. Like, all right, I got this body. What am I supposed to do to improve how I age so I'm thriving as I age and going through these phases of life? So for you, you're focusing on women. Do you feel that women have more struggles than men, or and why do you choose women over men, or not
So
both?
it is interesting. I say that I work with midlife women, but the midlife women will send me their men as well. So I do work with men also. I like to say that I work with midlife women because that is a struggle that is closest to me. That is my own
Mm,
struggle. That is what I know most
hmm.
intimately, right?
Yeah.
And I feel that there is so much work to be done here. And of course, it can radiate out, and women always bring their families. When they get the help, then they'll bring their children and their partners and other people. But I just feel the arena of midlife health for women is so vast that if I just focus on this, that's
Hmm.
more than enough. It's very fulfilling. It's very satisfying because in any person that I work with, I see a version of myself at various stages, right?
Hmm.
So it's gratifying to see that, and then to be able to help people move through those stages. It's
Hmm.
very it gives me a lot more than just kind of yes, I get paid to help somebody, but the reward really is in the progress that they make in their own life of achieving their own health goals, right? And then telling me that they feel better than they used to feel. So it's all very gratifying.
What age do you think that we should start paying attention to ourselves and being a health optimizer?
I think it should begin at the beginning. I don't think we should wait for a certain stage. The thing that does happen though, healthy habits should begin at the very beginning of life, right? Teaching our kids to eat healthy, teaching our kids to um, understand the difference between, eating because you're hungry versus eating because something else is missing in life. Teaching all those things, it begins right from the beginning, right? And that can happen if we ourselves are in a state of balance, right? So we teach our kids what we can. And the interesting thing is, for girls, we teach them about puberty and pregnancy, but we never talk about what comes later, right? And
Yeah.
perhaps the tide is turning because suddenly there is a lot of talk about menopause and perimenopause, but it's a pretty recent phenomenon,
Hmm.
right? We didn't talk about all this until now. And if suddenly we see, oh my gosh, everybody's talking about it, well, for good reason, right?
Yeah.
When I got to this stage in my life, nobody had talked to me about it. No one, not my mom, not my sisters, nobody, right? So I
Hmm.
come into perimenopause and menopause completely unprepared. And that's how I got into the deep dark hole of burnout. So if we start teaching our girls pretty early on that women's lives are just a big play in this hormonal soup, right? And if we learn to make friends with them, if we learn to understand, it's going to be the play of estrogen, progesterone, and testosterone is there in our lives for life, and the sooner we learn, because so many kids are put on birth control so early on because they have painful periods or, other reasons, there are better ways to deal with that, right? If somebody has PCOS or infertility, what is the right way to deal with that? Women in their 20s and 30s, if they have really painful periods, birth control is always the option. Even in our 40s sometimes, or even early 50s, women will still be on an IUD, not for any other reason, but they are getting these hormones from those sources. And we really have to question, is this the best way? Is this the best thing that we can do? Right?
Hmm.
So it starts with education, but how will mothers educate their girls if mothers don't know this themselves?
Yeah.
I just feel like the biggest job we have right now is educating women.
Hmm. So education, is it related to avoiding fatigue, burnout, and breakdown? Is that connection? What's the connection of that with our hormones as we age?
So, what happens is the complex interplay of not only estrogen and progesterone, but also other hormones like insulin, like thyroid, like cortisol, right? So understand now, we are not, I'm not expecting women to start to understand the complex interplay of these hormones, but I just want you to understand that there is something happening and reach out for resources that are accessible, that bite-sized, that can help you. Just know that, especially when you're coming to your late 30s, early 40s, um, your ovaries are beginning to shut down their production of hormones, right? And when perimenopause begins, which is, it varies from woman to woman. Sometimes it can start like up to 10 years before menopause, sometimes just a few years before. But what I would say is, in your late 30s and early 40s, if you're feeling run down, if you're feeling exhausted, if you have any symptoms that keep you from optimal, it is time to question. Could it be that my hormones are beginning to act up already? Right? So there is the one way to understand this is know what are all the symptoms of perimenopause and menopause, right? Other than hot flashes and night sweats, what else is there that we need to look out for? Right? If
Mhm.
suddenly you cannot do your workout that you've been doing for a long time, if you're suddenly beginning to get winded, if you suddenly have to stop your Zumba lesson in the middle and walk out, which is what happened to me, it's like, I can't do this anymore, If those things are happening, if you have symptoms like what you don't understand, you have these weird joint pains, you're beginning to get this bunion in your feet, you having frozen shoulder and things like that, these things are not known that they are related to hormones,
Mhm.
right? So the more we find out what is an inventory of symptoms. Now, if you, let's say there are 50 symptoms, there's probably many more, but let's say there are a list of 50 symptoms and you have some of those. Does it mean that your hormones are at play? Possibly.
Mhm.
Not always, right?
Mhm.
Let's say you have acid reflux. Let's say you're early 40s and you have acid reflux, right? You have GERD, you have this acidity, and you are reaching for that acid blocker, right? Some kind of pump inhibitor. And you correlate it to hormones, or is it something else going on? It could be both. It could be a combination of those things. So it's really helpful to begin to get familiar with a whole list of symptoms, but also be in touch, find the practitioner you find comfortable working with, right? Do your research. Finding the right person for you isn't so easy. There
Mhm.
aren't that many practitioners who have the training and the experience to be able to help women. So it's a combination of things. There are a few really excellent books that are accessible, that are not very technical. So I recommend those to a lot of women. So, get one of those books, read those, um, and do your research on who could be a potential good practitioner for you. Listen to what they're saying, see if they're a match for you. And then at some point, you might want to have a just a preliminary consult to kind of see this is what's happening with me. What do I need to be concerned about? What do I need to look out for? How do I know if I need to do something right now versus do I wait? So these are all
Mhm.
questions. Each woman, it has, it's individual. Some women will have symptoms early, some won't. So it's just important to educate yourself through a nice resource. Some women might like podcasts, some women might like books. So depending on what you want, there's resources everywhere. And then do a search for a practitioner that you feel comfortable with and run this by them.
Mhm. Yeah, I also wonder a lot of, the role of genetics and why does some people struggle more than the other? And then another topic I'll just throw in before I forget is I thought I was having adrenal exhaustion or HPA axis dysfunction. And how would we know, what is what? So looking at all these different symptoms, how do we know if it's hormones,
So,
dysfunction, imbalances?
right. So adrenal exhaustion is also a hormonal dysfunction, right? We're
Yes.
talking about cortisol at that time. And if we go a long time with hormones that are fluctuating a lot, which is what happens in perimenopause, right? Our body still produces estrogen and progesterone, but the variation from day to day is a lot. And even intraday, through the day, there can be a lot of variation. And that causes a whole host of symptoms, right? But but the trend is downwards, right? There's a lot of fluctuation. One day your hormonal level might be totally non-existent, and the next day it's super high, right? So this variation causes us a lot of symptoms and discomfort, but the overall trend over years is downwards, right? So that is a kind of hormonal depletion that's happening. And as that's happening, and we are not recognizing, and we're still trying to do what we've always been trying to do, then we are going to get into a cortisol dysfunction and an adrenal fatigue, exhaustion kind of thing. So these things are all interrelated. But I feel like the most important thing to consider in your early 40s, mid 40s, that stage is figure out what's happening with your estrogen and progesterone. And that's not easy because there's no simple blood test, right? So there are ways that we can find out. So that's why I say when I talk about hormones, I don't just mean estrogen and progesterone and testosterone. I also mean cortisol and insulin and thyroid and
Mhm.
parathyroid and other hormones that are important for the endocrine system is a completely interconnected and very finely balanced system.
Yes.
And when our estrogen and progesterone are doing their crazy dance, that's when a lot of women begin to get diagnosed with hypothyroidism as well, because estrogen and thyroid have a very intricate balance. And when your estrogen is super low, your thyroid gland is going to struggle, and your brain is going to have to put out more and more and more of the thyroid stimulating hormone, trying to get the thyroid to produce more thyroid hormone. So if we don't control the main hormonal um, central control, then all the other things are going to be askance, askew as well, right?
Yeah, so it's like an orchestra and who's in
It's an
charge and do
orchestra,
we have
and
to
you
have
kind of have
all the
to
players?
know where to begin. What's the first thread to pull on? What is
Yeah.
the first thing to begin to bring in balance? And doing that, starting there, makes a big difference to the rest of the things. Doesn't mean that we don't
Mm.
have to do something with the thyroid, but I would start with the estrogen and progesterone and testosterone
Mm.
and build other things in as needed over time.
So working with balancing, getting the right amount for you at what age you are for estrogen, progesterone, and then kind of downstream impacts will be the cortisol DHA balance and thyroid balance. You find
Yes.
like
Mhm.
working backwards at the root
I
cause.
I find that that is the way to begin. You know, if somebody comes to me in their mid 40s and their thyroid is struggling, I am not just working on their thyroid, right? In
Yeah.
any case, even if, let's say, for some reason they were not a candidate for hormone therapy, let's say, for whatever reason, either they didn't want to do it or there was some contraindication, right? Even then, we wouldn't just do the thyroid. We would look at the gut and we would look at the whole life and stress and sleep and all of that stuff, right? But I find that if we, for whatever reason, if we don't want to address the central thing that happens in a woman's body, then we are kind of tinkering around the edges. We can still make a difference and help the individual, but I find that we might be handicapping ourselves. Yeah.
Yeah. I find that it's essential to look at work backwards. And even we did a seminar last week with Ivana, Life, Amy, and Rhonda of Sweetwater heart rate variability testing. We were talking about the root cause, starting with foundations, as even strengthening the vagal nerve first, and then working on wherever we need to go. But just how we have to have the foundations in place so we can have all these body parts working in order. And we call it metabolic harmony to create that balance between all the systems is so key because it doesn't one doesn't work alone with the other, as you're saying, they're all interconnected.
It's all interconnected. And I'm a big believer in this whole work of the vagal nerve and HRV and how important it is, and mindset
Mm,
Super, super important. I have seen amazing changes in health when people have a positive mindset that they can make the changes that are necessary and
yeah.
feel better versus somebody who is so exhausted and has kind of given up hope, you know. So
Yeah.
mindset can make a big difference. So yes, I'm glad that you're doing this work.
Yeah. Well, I found that my own issues when I had my struggles with metabolic chaos early on with, there was no look of my estrogen progesterone really 2013 when my signs, symptoms, red flags were hard to miss. I was completely exhausted. I gained 30 pounds. I lost muscle. I had no energy to do anything. And no one, in functional medicine, we're looking at hormones and looking at saliva and looking at dried urine, the Dutch test, but no one really was addressing until recently the connection of also, oh, I was 42. What was my estrogen doing and progesterone levels? We looked at DHEA because you look at that, but no one was really looking at the perimenopause even 10 years ago. Do you think that
Yeah.
was something new?
I think timing is a big thing, and the time for menopause has come in the last, I don't know, just a few years.
Yeah.
And perimenopause is really now everybody's talking, it's like, but the thing that I like to say about that is, yes, possibly at 42, when you were complaining about the ulcer, somebody should have thought to look at your hormones, right? And figured out
Mhm.
what was going on. And perhaps you needed a very slight prescription of one or the other of the hormone, and that would have made a big difference. And but I'm sure as you probably know this whole debacle that has happened with women's hormones and all that
Yeah.
stuff, and how doctors have really been very hesitant to have that conversation with women. And so the tide is turning in a really big way. And that's a combination of women just saying, I've had enough of this,
Yeah.
and being amplified by social media, right?
Mhm.
So it's a perfect storm to amplify um, solutions to a problem that have gone unaddressed for a very long time.
And that's my point that say, well, that's 12 years ago. How much has changed? This is more recent that, yes, we were looking at functional medicine, looking at hormone balancing. And nowadays, it's all about estrogen and getting hormone replacement therapy, but it goes back to everything else because it gets oversaturated in a market that, all right, I'm going to solve all problems if I take this supplement or this hormone. And it's
Yeah.
really, oh, I have low thyroid. If I take T3, I'm going to solve all my problems. If I take estrogen, I'm going to solve all my problems. So that's what, we all talk about the holistic approach and working on the breath work, cold plunge or face plunge even, and sauna and breath work and grounding and all that. But I think we have to always put in there, you guys can't just go take estrogen and expect miracles. I think we have to really personalize. And that's what I feel like this kind of trend right now, perimenopause, menopause talk is just all over social media, which is great. But I think we got to still always talk about nutrition, exercise, lifestyle habits, and as we call the dress protocol, supplements when needed, but you can't out
Yeah.
supplement poor lifestyle habits.
Yeah, I am a big believer that, I don't take on any patients. If all they want is a prescription for HRT, they're not my person. I'm like, there's many other people, many
Yeah.
practitioners you can find that you can work with. And so I actually don't do that. So for me, the minimum that I'm working with somebody is like, we are working on your hormones and your gut, right?
Mm,
Those, at least those two things together. But, you know, for me, the thing is, everything is related. Your brain health, your gut
mhm,
health, your hormonal health, the toxins in your body, the inflammation in your body, right? What is your heart health like? What are you doing for your bones? What is the state of your immune system? All of that is so interconnected. And but it's kind of like we are going to go through this phase, I think, for the next number of years where women are just like, wait, you're telling me this is good for me and I should do it and I haven't done it, so let me just do this one thing only, and then we will see about the rest. And I don't really fault them for that
mhm.
because the suffering has been significant, right?
Yeah.
And but that's not my approach. I like to approach this as a whole complete system. The body is a complete system, and I want to work on it as such. And also, what ends up happening is I end up attracting these women who their doctors have either said, sorry, I'm not gonna, this is not my thing, I'm not gonna, or they have cases where their doctors are not able to figure it out because they have these one-off unique challenges, like, somebody didn't have a period for like 3 or 4 years and suddenly they're cycling again. Unusual things, things that require digging deep into their whole system and figuring out, okay, well, what's happening? So kind of like that. So it's a deep dive anyway.
Mhm. I want to go back to you mentioning gut health, and that's always a big topic for us here, for me. And what would you say is the relationship of gut health and hormones?
A very big relationship is like the health of your microbiome, right? Your microbiome is directly and indirectly producing hormones, byproducts, metabolites, and all of those are having an impact on your mood and your physical health, right?
Mhm.
Like for instance, when you take progesterone, oral progesterone, it goes through the liver and produces GABA-like substance, which is an anti-anxiety substance,
Yeah.
and it helps us sleep, right? So it's the effect of the liver and going through the whole um, system, the digestive system, the liver and the intestines, and what is finally produced that is helpful for us. For estrogen as well, we want to make sure when you are taking the estrogen into your body, and my preference is always that women should be taking estrogen through the skin instead of taking orally, right? Because those are the metabolites that we do not want, right, in our body. And then, of course, the Dutch test will show you how you are metabolizing hormones, right? There are certain pathways that are more helpful, others that are not. So the makeup of our gut, what kind of bacteria we have, do we have the right um, proportion of the phyla, of the families of bacteria that exist to each other, and the relative proportion of the different families to each other? Is there a preponderance of bugs that predispose you to autoimmune conditions or things like bacterial overgrowth in your intestines, in your small intestine? Um, and many of these bugs are like, they will tell us, what is your hormonal balance? Is it optimal or not? So we know which kind of bacteria, what kind of balance to look out for in the gut to kind of know how well you are doing on your hormone metabolism. So it's
Mm.
a very close connection between what's happening in the gut, how healthy you are. Do you have a leaky gut or not? Are you able to absorb the nutrients or not? And another thing I would say is, when I start somebody off on hormones, I always like to understand what is the status of their gut first. And I also love to test for toxins before I start women on hormones, is
Mm.
because we want to make sure we understand what is the toxic load that you're carrying and what is the state of your gut. Like, is your gut in a position to absorb the nutrients that we are going to give to you? If
Mhm.
not, then first work on that, because then what can happen is you might need a dose of hormones that is higher than you would need if all the systems of your body were normalized, right?
Mhm.
So it is much better to work on the gut and the detox first and then bring the hormones in than to do it the other way around. So being that
So,
it's all connected, just
yeah.
doing it in the right direction makes a big difference.
So with the liver, then, do you focus on liver detox pathways, drainage pathways, gallbladder, bile flow, lymphatic?
Right. So all of that is part of the work on the gut, right? All the things that you just mentioned are things that we need to make sure are functioning well. And they're, as we like to call it, as naturopaths like to call them, the emunctories are open. So all the things are flowing as they should. Your lymphatics are flowing as they should. Um, and all the, the gallbladder is not congested. There's enough bile for each meal. And there is no or at least you minimize your risk for gallbladder dysfunction, which is
Yeah.
not uncommon in midlife women. A
Mm.
lot of women have had their gallbladder removed,
Why do
right?
you
For
think?
one reason or another. I think the reason for that is manifold, right? But the biggest one I feel is there is not real understanding of what good digestive health is, right? I'm perpetually shocked at how many women don't know what constipation is, right? How many women think if they go to the bathroom twice a week, it's fine.
Yeah.
So knowing that the different organs of your body have a different function and they work optimally when they're working a certain way. So proper elimination, proper eating, making sure you have enough digestive enzymes, that you sit down to eat, that you're not eating in a fight or flight state. All of that is part of good digestive health, right? Digestion begins from the moment you think about food, right? Because your mouth is producing the digestive enzymes right at the thought of food. So eating it slowly, mindfully, is a big piece of digestive health. Now, another thing that I find is so many women have self-selected into two or three or four kinds of foods because they just
Yeah.
identify like this is what helps for me. I'm not going to eat the other stuff. Well, that is not helping us. One, the joy is gone out of food. Many people don't eat joyfully today because it's like, oh, that is not good for me, and this is not good for me, and I don't have time to cook, and I don't even know how to cook, and I don't have time to shop. So I'm just gonna have these three things. And that's like, how can that be
Yeah.
fun or
I
good?
know.
So
Yeah.
I think all of these things go into creating this epidemic of poor digestive health. And then it
Hmm.
leads to a poor, many things like many women have this pain on the right side, and I don't know what that is. And the scan shows there's no problem. Like, okay, well, then, a lot is going on in your body. Maybe it won't show on imaging, but there's a lot that can be done with working on all the foundations of health, right?
Hmm.
And working on what you're eating and how you feel about it and what is your stress level and all of that.
It's what I talk about all the time. It's so great to hear that. That's kind of what led me down the rabbit hole of the vagal nerve because I was tracking everyone's wearing Aura or Whoop, which I don't believe are very accurate compared to wearing a chest strap, wearing a heart rate strap to get your true heart rate variability. And then we can look at the low frequency to high frequency ratio, which is the balance of your nervous system. But I was seeing kind of correlations between poor heart rate variability scores or lower scores than optimal and their lab tests, their GI tests, looking at their gut, going, And then a lot of women had their gallbladder taken out or they had poor liver gallbladder markers. And so I started going, what? What's this all mean? And then led me down to really the powerful role the vagal nerve has on all this was how I got down a deep dive into the vagal nerve, but that's a big part of it as well, as we mentioned.
Yeah, yes. I mean, all the work that has been done on the vagal nerve. What's this doctor's name? Dr. Steve Rosenstein? What?
Oh, yes.
I don't think I'm saying the name right, but anyway,
Yeah.
so I think it's really critically important work, understanding the importance of how the vagal nerve functions and how you can switch into parasympathetic and how important it is for us to live large portions of our life in that
Mhm.
stage, and learning to recognize when we get out of that so that we can bring ourselves back into it just by
Mhm.
breathing, just by knowing what is your resonant frequency and
Mhm.
breathing at that rate
Yeah.
I find it makes a big difference in a day-to-day life where you don't need any contraptions, no devices needed, right?
Hmm. Yeah, so powerful and simple too, and
Simple, yeah,
free.
and free. Yeah.
So with the hormones, a lot of women, we're getting older, we're starting to see kind of like, oh, unexplained weight gain, and I'm doing all the things. I'm doing the strength training, or they're doing this, they're trying to do more protein. What do you think are some common struggles people come to you that say, I want some estrogen because they hear all this on social media and podcasts lately?
Right. So as I mentioned, like I generally have a pretty in-depth conversation before I
Yeah.
decide to work too closely with somebody, right? It's an in-depth conversation on what are they looking for long term, really, instead of just a prescription. What are they trying to drive at? What is the
Yeah.
goal that they want to arrive at, right? And then we kind of see like, okay, these are all the things that are happening in their life. They have low energy. They are so fatigued. They can't understand where they are in their perimenopausal region. Another big thing is migraines is a big concern, like, and they
Mhm.
begin to get worse sometimes when women are in perimenopause. And of course, your hormones have a big play in that. Also, there isn't enough understanding that as we grow older, our metabolism actually slows down and our need for calories isn't as much as it was earlier. And so part of that is habit, not knowing that, listening to your body. Do you actually need that food, right? That's one thing. I do think emotional eating is a big part of life just today in the 21st century. There's so many things missing in life. And so we look for satisfaction in food. Of course, when you go through perimenopause and menopause and your body is no longer producing estradiol, then the body is going to resist losing fat because that's what produces estrone, a kind of estrogen that is more inflammatory, but that is produced by the fat tissue. Also, as we get older and we accumulate toxins in our body, they are sequestered in fat, so the body resists losing fat for that reason as well. So it is never just that you take hormones or you take estrogen and you're going to lose the weight. I do find that when you do the work on detoxing, when you do the work on eating right and working out and doing the hormones, then it becomes easier to be in a state of health and to lose the weight that is right for you, as long as your expectations are realistic. I
So,
find that's helpful. Yeah.
so it sounds like your order of operations, I would say, is start maybe with the liver detox pathways.
So my order of operations really is first understanding where the person is
Mhm.
and understanding and getting to an understanding of what the goals are, whether we are working
Yeah.
together for 3 months or 6 months or 9 months, what is the goal that we are driving at, right? Once we lay down the goal, then generally the first thing that we are working on is the gut. Okay. And so then I will do some sort of a testing, a stool test, perhaps also test our food sensitivities, and kind of understand, from their symptoms and the testing, we understand, okay, what's going on. And then we see what is needed. Somebody might need I find a lot of women come with symptoms of small intestinal bacterial overgrowth that has never been diagnosed, and it's causing them enough discomfort. Or sometimes somebody has been on acid blockers for 10 years.
Mhm.
And so it really varies. I generally don't put people on a liver detox or a gallbladder detox. I don't do those things like that. What I do is like, okay, to bring the gut into a state of balance, what do we need to do? What is in the gut right now? What are you feeding the gut? How much fiber is there? Do you have digestive enzymes? Do you have enough acid? Is your body producing enough? Do you have enough bile? So all these things. So the first couple of months are really just getting the gut dialed in. And sometimes it's less than a couple months, sometimes it's actually more, depending on how much work is needed. If they're not moving their bowels, if they're not digesting well, perhaps start with some bitters, perhaps, really sitting down to eat and all of that. So certainly gut is, number one. And then toxins, right? Bringing the toxins out and then working on other things. But
Mm-hmm.
but I don't have not been prescribing like a liver detox or gallbladder flush as those things specifically. It's all part of the, okay, we are working on your gut at this time.
Mm-hmm. That's great. So that's kind of what we say as FDN practitioners. You're testing and not guessing and creating personalized programs based on a health investigation to put the missing pieces of their health puzzle back together so they can feel their best and thrive as they age.
Yes, correct.
Yeah. Yeah. So I think it's important to share that because, as we said, it's so popular right now to solve all of our issues by taking thyroid medication, and now it's estrogen replacement, but it is often part of the missing piece of their puzzle that they may need to have some supplementation where they're not getting enough of is balancing
Yeah.
their hormones.
Yeah, I will tell you this, like a lot of times when women come to me and I will do a questionnaire, a menopause questionnaire, and I have that set up as a quiz on my website, and a lot
Yeah,
of women
put
will
that link.
take that, and that helps me score where they are today, right? And then as we do the treatment, we are rescoring over and over. And I will tell you that um, hormones can make a big difference, but they're not going to solve everything. So it's not the end all and be all, but it's going to make a big difference, right?
Yeah.
So it's important to give something the importance that is due to it, but also not overinflate and over exaggerate. It's not a panacea, but it will help you a lot. Like, for
Hmm.
instance, somebody comes to me with this brain fog, and we work on all the other systems of the body, and they have this high score of like 88 on the menopause questionnaire, right? Like super high score. Many, many, many symptoms that are severe. Okay, after doing the initial preparatory work, put them on hormone therapy. Over the next 3, 4, 5, 6 months, that number goes down to literally in the teens. Okay, so now what is still remaining? Okay, well, the detox that so it's like the detox needs to continue. Let me test you. Your mole toxins are still high. You are still have a high level of glyphosate in your body, right? And so many people have this exposure to uranium and cesium and stuff like that. It's like, where is it coming from?
Yeah.
Not a lot of people are drinking groundwater these days, right? Like well water, but it's in the air, right? Even the Alzheimer's Association is now saying that air pollution is a risk factor for Alzheimer's dementia. Well, what are we going to do about it? Not
Yeah.
breathe, right?
Yeah.
So it's even more important to understand the impact of environmental pollutions and toxins in our body and what do we need to do to get it out, right?
Hmm.
So everything has a place and there is a time for everything. And also the other thing is with hormones, it's not as simple as, okay, here's your prescription and off you go. It takes a while to figure out what is the right balance of the various hormones for you, right? A certain level of estrogen and progesterone might work great for one person, and for the other person, I'm beginning to get a period again. What should I do? Oh, we need to adjust your hormones. So, kind of hanging in there and knowing that your body is a very efficient system. If you give it the hormones it hasn't had in a while, it might begin to start functioning in a way that you're not expecting. And then so we have to say, okay, in your case, then we need to dial down the estrogen and perhaps dial up the progesterone a little bit. And then we have to see, well, but is the progesterone making drowsy in the morning? Because that's not a side effect we want. We want you to just have your full night's sleep at night, but make sure you are good to go in the morning.
Yeah.
So, kind of titrating and calibrating the levels of these hormones, again, is very individual.
Hmm.
Some
Yeah.
women do great at lower levels of hormones. Some women do much better at higher levels. And then, of course, we now know that to address your physical symptoms like hot flashes and night sweats, you don't need a huge amount of estrogen. A little bit will do. But to give you benefits for your heart and bones, you need a little bit more. And to make sure that you don't have brain fog and cognitive decline, you need more. So it's kind of like taking your subjective symptoms into account, plus also evaluating perhaps on neuropsych assessments of how you're doing and working on all the other stuff as well, right?
Yeah, so true. It is the Goldilocks effect for everything, just the right amount your body needs to create the positive effect. One more question on cognitive decline. That's a big thing, is a memory, brain fog. And as I keep talking about in the podcast last few years, just watching my mom and all of her friends, because my dad passed away 2 years ago, and just seeing all the changes when we are older. And that's kind of shifted my focus more on even this podcast is improving how we age. And a big part of that is this cognitive decline that so many people, my mom's just lost her friends from Parkinson's, everyone's getting dementia. And just I watch all that and I just doing everything I can do now to avoid it, ideally. But what do you find with cognitive health? How to avoid as much as
Mm.
we can as we age, the cognitive issue?
The first thing is to just know that there's a lot you can do. It's not something, it's not inevitable. Like it's not like, yes, the cases of dementia and Alzheimer's are increasing a lot and they have increased in the last few decades, but it's explainable why it is because it is, of course, genetics plays a part, and we didn't talk about that, but genetics is important to know, especially when it comes to dementia. There are certain genes that predispose you more to Alzheimer's dementia, especially for women. It's very important to be aware that if their mothers or grandmothers had dementia or sisters, then our risk is higher, right? It travels more on the female side. And um, two-thirds of patients diagnosed with Alzheimer's dementia are women. And more research is coming out that dementia is actually a disease of midlife, not old age. Symptoms become inescapable by old age. You get a diagnosis in old age, but the disease actually begins in midlife. Think of it like a bucket, right? A bucket takes a long time to fill, but you might not know what's happening until it begins to overflow. And by that time, often it is too late, right? So, what we can do, especially midlife women, it is so important for us to be aware that in today's world, dementia is a real risk. And if we want to age well and be fully independent until the very end of our lives, it's really important to understand the risk factors. What are the various risk factors? And understand what you can do about them, right? One thing is just find out what is your genetics for dementia. It's a simple, I'm not talking about a whole genome-wide testing. I'm talking about just simple genetic testing, right? And that tells you a little bit about your predisposition. Now, generally, it is known that the ApoE3/4 or ApoE4/4 predisposes you more to Alzheimer's dementia. And that is true. Historically, that has been the case. And the ApoE3/3 is neutral, like it doesn't increase your risk for dementia. And ApoE22 or 23 is actually protective against dementia, which is not that common. It's those smaller numbers. The thing though is if somebody has ApoE33, they might feel, oh, thank God, I don't have that higher risk. However, ApoE33 tends to accumulate toxins in their body and have a difficult time detoxing. And I've seen many people with 3/3 with dementia. And based on what we know right now, and we are finding more and more research comes out every day about like, okay, this is another risk factor. Perhaps this is something that we didn't know about before. But as of now, what we know is that toxins are a real thing, are a real risk factor. And we can measure many kinds of toxins. And of course, there are things that we don't know yet that are also having an impact on us. So I think it behooves all of us to learn what are the risk factors, what can we do about them, right? And perhaps get some testing done, right? You can do neuropsych testing. It's easily done. I offer this in my practice. Doesn't take a long time, 45 minutes. You can figure out how you score. The problem with the testing is that if you score high above average, that's great. You know, but if you score in the average range, it's really important to drill down because the average is a very broad range. It's like the conventional range on a lab test, very broad. So you have to drill down into what percentile you are on the different metrics to understand where you really are, or do some blood testing. Now there's new blood tests that can tell you if you already have plaque in the brain. Okay. So
Wow.
there's many things that you can do about it.
Mm-hmm. That's good.
Yeah.
So I know I could go a whole hour about cognitive decline because I think I want to do a series on that actually on the podcast. But for all this, how can people get started? Maybe set a discovery call with you.
Yeah,
What are the next steps if people are curious to be health
absolutely.
optimizers?
Right. To be health optimizers, yes, certainly on my website, you can schedule a discovery call with me. I am in the process of recording a whole lot of um, podcast videos on these different topics, and I will be releasing them shortly on my own channel. And I do these webinars from time to time, and I did one a short while ago on how to prevent dementia. And so, if people sign up for my email list, I every week I send out information about what is the latest thing that we are working on. So whether it's me releasing an episode of my own videos on the podcast, or whether a new webinar that's coming up, or new testing that is being talked about in the world of cognitive decline. So I think on my website, just find a way that works for you to keep in touch with me, whether it's on social media or through email, or through a discovery call. Any of those things work.
Good. Yes. I think short videos are a great way to give people some information and help
Yeah.
just share as I try to do what are my experiments or journeys or discoveries because people don't have time to sort through all that information out there and just giving
Yeah.
people a little short snippet is helpful.
Right. Absolutely.
Good.
Yeah.
Well, so nice to talk to you. And I just love this area. Obviously, it's my passion as well, and just how to help people personalize what they should do. And it's not just one size fits all. We can't just take a pill for problem or a supplement or prescription drug. We have to work on the whole person. And that's what I love sharing too, kind of that holistic approach. Sounds like your similar path as well.
Yes, absolutely.
All right. Well, we'll put all the links in the show notes. Thanks for your time today.
Of course. Thank you, Debbie. It was wonderful talking to you.